governors. This is not the position of COG. The position of COG is always communicated by the chair of the Council of Governors, and that is Governor Oparanya. This is our position. County government of Uasin Gishu, county government of Elgeyo Marakwet, and so many other counties who stand to gain additional resources from the third generation formula. That's the point.
Concerning the preparedness of COVID-19, as our investigation, we have seen only 18 beds, but on papers it is 324. You don't have any ICU bed, as reported earlier.
Thank you very much. I don't know how many facilities have you visited?
Like 10. The only, like the Ktn'S, those beds belong to Ktn'S. Like Moikals, we have seen it only belongs to them.
Now, I think I don't want to engage you because you are on a propaganda journey. I don't know whether there was anywhere where it was debated on the ownership of the beds. Is it the availability of the beds or the ownership is your problem? Because, you know, this is where, again, we mislead Kenyans. If you read the circular from Minister of Health, my friend, and this is a problem of media who want to distort information, it is clear that it has been outlined that we have to work, county and national government, and identify institutions with capacity and with other factors considered, not just beds, accessibility of kitchen facilities, accessibility to clean water, and so many others. Even Kamalel alone, Bwana Jepkon, has 30 beds, and you are talking of 10. Unajua shida ya KTN na standard ni propaganda January to January. Najua mumeishiwa story. Sasa unajua mmewacha kuandika William Ruto. Sasa mnataka kuendesha tu propaganda hapa ndogo ndogo. We want to tell you, my friend, we are a very serious county when it comes to matters COVID. And I can tell you, in terms of preparedness, in terms of prevention, county government of Uasin Gishu is well ahead. We were the only county that was able to run an isolation facility before the rest were doing it. The fact that we were even talking of 324 beds, that is just the minimum that the ministry had asked us to do. KMTC alone has more than 200 beds. Moi Girls is an institution that normally supports 1,000 students population. But we are setting these facilities also based on the recommendation of Ministry of Health. So we cannot convert so many beds at waiting for COVID. The other thing you must understand, Bwana Jepkon, is one, we must continue running our health facilities because the other diseases have not stopped. People of this county need still to access maternity services. People still need to access health facilities for other ailments. As a nation, it is not that COVID arrived na yale magonjwa mengine yote yakapona. We are running 121 facilities in the county government of Uasin Gishu. We have only identified, of the health facilities, we have only identified 7 of them for the time being. The reason, we must continue offering the other services so that other ailments don't come and overtake and kill more Kenyans than actually COVID-19. So, the thing of you are not prepared, my friend, your investigation is null and void, it is fake, na mwache kuandika fake na report fake news. ICU beds we have, and for your information, are you aware that even MTRH, we are the ones who have supported them with ICU beds? So where do you live? So you are only answering what you know. Na maana rais wakati mwingine alisema hii maneno ya magazeti ni ya kufunga nyama. Sometimes it is true, ni ya kufunga nyama. So help us, my friend. And let me tell you as a media person, COVID-19 will not respect you because you are in media. All of us, let's work to send information that is going to help us as a nation and as a county and as a region to actually deal with this COVID-19. And finally, let me say this on COVID-19. Let's emphasize more on prevention. And that is why today, the President has announced that all bars will be closed. All eateries are not going to sell alcohol. Why? Because it has been found that where alcohol is involved, it is impossible for people to keep social distance. It is impossible for people to keep their masks on. Even cleaning of the classes that are being used in those places, watu wanamwagia tu maji namna hii na, and it is fueling the spread. We are talking of almost over 50,000 infections in the country. Was in Gishu alone, we are handling almost 200 cases of COVID-19. Even if we are to buy ICU beds, shall we be able to buy 200 ICU beds? Shall the country afford to buy 1 million ICU beds? Kenyans, let nobody lie to you. The best you can do for yourself before you are infected, protect yourself. And remember, the Cabinet Secretary of Health and the President has said the responsibility of protection has shifted from government to you as an individual. And that is why the country had to make a painful decision of opening up the economy so that we don't lose in all the fronts. And we believe Kenyans are responsible. We believe Kenyans can follow the protocols that have been set by Minister of Health. And in fact, today again, there was conversation on matters of school children, whereas government closed schools to avoid the spread. But parents have allowed children to actually leave home, come to town, to walk around in town. They have allowed children, 300 children are going to play in one crowded place, defeating the same purpose as to why we closed schools. So we want to remind all of us that this COVID business is not a government business. It is the responsibility of every individual in this country. And all of us, let's work towards making sure we reduce the rate of infection and finally flatten the curve, and finally we can be able to deal with this pandemic, hoping that we shall get a vaccine in the near future so that this pandemic can be dealt with. I can't, but let me tell you, blatantly I can't. And you can publish, and you have a choice. Because we also have to deal with you the way you deal with us. Wana ya Ochieng. Na unajua mimi hakuna maneno ya lugumba hapa mara moja. Na kuambia vile ilivyo. Our advice to parents. One, please don't use your children to come and do hawking. And don't even allow your children to come to town unnecessarily. And there is something that parents need to understand. The reason we are having a very high spread now in the country, as per Minister of Health, from the technical experts, is that young people are infected, and the majority of Kenyans, at almost 80%, they are asymptomatic. That means they are not sick. They are not in beds. They are not in any hospital. And therefore, the spread is likely to be high. If you allow children to come and hawk, they can be infected, but they might not become sick. But they are now going to infect the people at home who are also aged, people who may be having other conditions, and that will accelerate the number of deaths in the country. This country benefited from the early interventions the president put in place. If you compare the global average of infection, which starts at almost 4.5%, compared to the Kenyan national average in terms of infection that stands at 2.1, it can only be associated with the tough initial measures that the government put in place. If we continue with those measures, then there is a very high likelihood that our rate of infection will not be too high and overwhelm our health systems. And there is a possibility, but by the time we are almost having at the peak of the infections, probably a vaccine might have been found. We shall have both enough time in terms of even building capacity. Today, in our discussion at the summit, one of the things that came into play is that, yes, we have ICU beds, but where are trained nurses to handle all these ICUs in the country? You can have the infrastructure, but you have the personnel. We have now discussed and agreed that health workers with that kind of expertise who retired from service can be recalled to come and assist in training and also increasing the technical capacity available to deal with this situation. Asanteni sana. Namna hiyo.